Hello friends, today we are going to discuss a very important topic. Patients usually ask us, Doctor, what should I eat? And the presentation is based on this study, which is a review article which has been done in the Harvard School of Public Health in the Department of Nutrition. So I have put some pictures from the internet for the sake of ease so that we get an idea what is important and what is not. So the main points are that women who are trying to conceive should have more of whole grains, soy, fish, and omega-3 fatty acids. They should avoid trans fat and red meat. And special importance should be taken to the presence of contaminants in the food, which nullifies the nutritional importance of diet. So what does that mean? It means that the food should be sourced well. It should be organic and it should be sourced well. So the importance of folic acid. Folic acid is very important. It is an enzyme which is used for the formation of DNA and it should be started preconceptional. It is well established that taking folic acid helps in preventing neural tube defects. But folic acid is also important as it increases the chances of pregnancy, it lowers the time to pregnancy, and patients who are on folic acid have a very less chance of having anovulation. Vitamin D is very important for reproduction as well as other body functions. People who are vitamin D deficient have poor reproductive function. Vitamin D from natural diet can be sourced from mushrooms, fish, egg yolk, beef, liver, cheese, tofu, yogurt. Carbohydrates which have a low glycemic index should be preferred. For example, whole grains. Because they have a high fiber content, they help in improving the fertility by reducing the estrogen levels. Now let us look at the fat. Fat intake should be less, but omega-3 fatty acids should be the fat of choice. Trans fats should be avoided. So if you look at these pictures, the fats which have omega-3, these substances which have omega-3 fatty acids like flax seeds, walnuts, kidney beans, winter squash, green leafy vegetables, salmon and pecans. So they have omega-3 fatty acids and they are very good for our diet. Whereas if we look at the trans fats are present in all processed foods like chocolates, cakes, biscuits, pastries, french fries, fried chicken, pizza, burgers. So these are the things that we should avoid in our diet. So basically everything that is bought from outside or cooked outside or is kind of junk food should be avoided. And everything which is in its natural form should be taken. Now if we look at the protein content, the problem with the protein content is that dairy, meat and fish are the sources through which the environmental contaminants enter into our body. Even when soy and fish is good for our diet, the environmental pollutants should be taken care of. That is, the food should be sourced well. Soy food sources are tofu, soya milk, soya protein powder, and soya cheese. Now, what are the other concerns as far as the food is related? Other concerns are that when we take outside food, there is some kind of packaging, there is processing, storage, and transport and heating. All this involves addition of some kind of preservatives in the food, and they lead to problems. Mercury in the fish, pesticides in the produce, growth hormones, and antibiotics which enter into our body are matters of great concern. So, by reading all this, I think everybody would have understood that if we take fresh food in our diet, it should be properly washed, all the pesticides should be washed off, and what is good for us and what is bad for us. Trans fats are present in most of the foods which are cooked outside, they are processed outside. Whereas home cooked good meal, which has a low glycemic index, is something that is good for our diet. Thank you very much.